Hi guys, Dr. Sheehan here, and I'm here to answer one of the most common questions that I get every day here in my dental implant practice, and that is, why do I need a bone graft if I'm going to get a dental implant? In order to understand what a bone graft is, we first need to understand what is a dental implant. So a dental implant is a little screw that gets placed underneath the gums into the bone that helps support your tooth. When a tooth is removed, remember the root is taken out. And so the implant actually replaces the root, so that way the tooth can go on top of that. So after the implant is placed, generally it takes 3 or 4 months for that area to heal, and once the implant becomes strong and stable is when we actually put the tooth on top. So when we place the implant, that's when we determine how stable it is. Sometimes it takes 3 to 4 months for that implant to become stable and actually heal within the bone, and that's when you get your tooth. Sometimes we put the implant in right away and it's stable, and that's when you get your tooth. It's all dependent on what's the situation, how much bone do you have, and how fast we can get that implant to become stable. Okay. So we talked about what an implant is, but what's really important is we have to determine what size implant you need. Not all patients need the same size implant. We decide that based off, a number of different factors. How hard you bite, how much you chew, your size, how many implants are we putting in. Lots of different details go into that decision. But what is really important is that we first decide what size implant you need, and then we see how much bone do you have, okay? Often, or sometimes, there's not enough bone for the actual size implant that you need. And so what we don't want to do is put an implant in that's too small. What we really want to do is we want to grow the bone. Bone grafting and bone building has become very predictable over times. There's lots of different bone grafts that, can be done. There's some really easy ones, okay? That's when you have a tooth taken out. Think about that. There was the root, so you've got a little bit of hole where the tooth used to be, and we fill that back in with some bone. We want to do that because that's going to stabilize, make that bone really strong and tight, and get you ready so that way you have enough bone for your implant in the future. Well, sometimes you had your tooth taken out quite a while ago, and the bone got really skinny there. And if you need a full-size implant and the bone is really skinny, we have to bulk up the bone with some bone material. Sometimes we have enough width, but we don't have enough height. So, up in the top, there's a sinus, that's the air pocket up here. And often we have a very nice fat ridge size, but it's too short. And so you have to remember that the implant needs to be completely covered to be stable, in the bone. So everywhere around the implant should be covered with bone. And that's when we do the bone grafts. Bone grafts can take anywhere from 3 months to heal up to 6, 8 or 9, depending on what are we trying to accomplish, how healthy are you, and what do we need to do. There's a lot of different bone grafting material on the market. Sometimes we'll actually use some of your own bone and just move it to a different area in your mouth. Other times we're just going to use some FDA regulated donor tissue graft. There's lots of different choices. What's important though is that we evaluate what you need first. What are we trying to accomplish? So we're picking the appropriate kind of bone graft material for you to make sure the bone builds up and it's stable. So that way when we put the implant in, you'll have a successful time. We talked about how there's a wide range of different kind of grafting. Some of it is very simple, some of it is very complex, though very predictable if done right. So patients have a lot of questions about these bone grafts. How long is it going to take? Is it predictable? Is it going to work? Bone grafting is very predictable. What's going to be important is that we choose the correct material for you and that we do the procedure in a very safe and predictable manner. So don't be shy and ask your dentist, have they done this before? Do they do a lot of these complex grafts? If it's an easy one and they're very comfortable with doing that, then that's great. If it's something that's a little bit more complex where you need to grow the bone on the outside of your body, don't be shy to ask some of those questions so that way you can have a predictable and successful outcome. Thank you so much for listening. I'm Dr. Amanda Sheehan. If you have any questions, feel free to message me or comment below.